everybody to our webinar number 5 in Climate Health Initiative. And today we are so lucky that we have with us Shilpa Rao, who works as a senior researcher at the Norwegian Institute of Public Health, but has a long tradition and a long history of working with climate health. I could say more than nearly everybody in Norway that I know about. You're going to talk about climate change adaptation and health equity, which is something that we are very much interested into. And as we usually do, we have 40 minutes in total, so you would talk like 25, 30 minutes, and then we have or something around that, so that we have some time for questions and comments at the end. Thank you very much again for being with us, and then the floor is yours if you want to share your screen with us or just introduce yourself.
Yeah, thank you very much. So thank you for the invitation to present at this webinar. And you've asked me a couple of times, but finally we got the date together, and I'm very happy that I can present today. I will share my screen now just to see if it works.
Perfect. Now is it.
Yes. Thank you so much. So I was a bit confused on the, topic because it's of course climate change adaptation, but actually the topic here is more climate change because this is a broader issue. While adaptation is definitely something of interest, there's a whole issue of linking climate change, health, and equity that has gained a lot of interest recently. And it's not something I've traditionally worked with. So it's, this presentation here is actually an exploration also for me, and also hoping to get some comments because I think it's a, very interesting direction to go into the future to look at equity aspects that are related to climate change. Just, for the picture, I showed this elsewhere. You see the Earthrise on the left, the famous picture from the Apollo, the first environmental picture ever taken, which made the world realize that, the whole world was connected together and that, we are all in the same boat. And then you have the recent cartoon from the COP29, which was an absolute disaster because of certain powers not participating. And so there's a whole shift, from viewing us as interconnected to more and more localization, more and more local, politics that are in place at the moment. So it's an interesting time to live in and an interesting time to carry out climate change research. So climate change is one of the. Do you want me to say more about myself, or can
You
I?
decide.
Yeah.
You can just go on. That's
Yeah, I
as
can
you
just
wish.
go on. I can tell you in the end who I am, but if you need more information. So climate change is, I think these lectures have been going on for a while, so I'm sure you've seen these kind of slides before, but climate change is one of the greatest health threats of the 21st century. And most importantly, it undermines environmental and social determinants of health. And this is what we are trying to talk about today. And there's a need for a lot of action to decarbonize economies, build resilience, and promote actions that both reduce carbon emissions and improve health, build better and more carbon resilient systems, and implement public health measures to protect from the range of climate risks to health. So it's been a lot of literature and a lot of statements out there, but I will try to show that this is not so straightforward to do these kind of things here. So the presentation has essentially just three simple flows. It has a background, a very short background that I will try to give you. The progress that I have seen so far in terms of what has been going on in this field, the research progress, and then the future, some kind of examples of future direction on where we are going now. So background, what is climate injustice? There has been literature on climate injustice for a while. And these are the kind of injustices that have been, talked about. There is a geographical injustice. So there's, differential vulnerability to climate change depending on where you live, what occupation you have, things like that. You have a lot of literature on indigenous exploitation, settler colonialism, and how that has affected climate justice. You have gender inequality, then you have intergenerational climate injustice, which has also received a lot of attention, that the children today are paying the price for the emissions that were, put out by our ancestors, by their forefathers. So there is no sense we're passing on to future generations this whole problem of climate change, for which we are responsible at the moment. There is economic inequality. Obviously, climate change happens in different parts of the world, but there is an economic inequality in terms of the both the emissions and the burdens as well. There is new literature which talks about racism, language and literacy barriers, discriminations, other forms of social inequality, and there are also the inequality of resources beyond climate mitigation. So there's also urban development processes, institutional and governance strategies. So there are various things that have been discussed with respect to climate injustice. There has been one recent paper that is very interesting that has tried to link climate change and the health framework together. While I don't have much time to go into this figure, it's actually very interesting and something that I would advise you to also read. It's an interesting figure that talks about, the health processes and strategies on the top, and then you have the climate processes and strategies at the bottom. And then the orange circles indicate the various implementation measures, what you call adaptation measures for climate change. But it could also be mitigation measures. So then you have ones in the middle like geoengineering, which are theoretically neither mitigation nor adaptation. And then for health, you have the various measures, including health education, risk reduction, and so on. But in the end, the statement that this particular paper makes is that there is a very strong link between health, climate change, and inequalities, because the processes that are driving them are essentially more or less the same. You have the systems, you have the institutional power, the social inequities, and these are prevalent across systems. And these tend to drive these kind of impacts together. And in the end, you get disability, health, and social costs, which is the final outcome on the right side. And you can see that everything contributes to this, whether it's climate related or health related, really doesn't matter because it ends up at the same point that you are sick. So there's a very complex link, both in terms of exposures, how the exposures interact together, as well as in terms of the interventions, how the interventions interact together. So this is a very complex area of research and not so straightforward, but I hope through my slides to take you through some of the recent research in this area. So in the research areas, I will focus on three main things. So modeling climate change exposures and health, which is primarily what I do, quantitative research in this direction. But there has also been some new recent research, which I've also been involved in, which have been looking at cross linkages of climate health interventions and looking at pros and cons of these kind of climate health interventions. And this is also an area I've been involved in for a long time. And thirdly, there's also been new research in targeted communication. Again, for me, this particular area is new, but there's a lot of interesting research also in this direction. So I will try to take you through the research in this area. This is a slide for which I am not responsible, so it's not my slide, but it's an interesting slide that talks about inequities across the globe. And you can see here, basically, the dark red countries are the ones who basically are the climate free riders. So the ones shown in dark red are the ones which are climate free. These are the climates which have the highest emissions and the lowest vulnerability, basically. And then if you have slightly brown, that kind of means that the scale is shifting, but everything in the red and brown means that emissions are high, but vulnerability is relatively low. And then you have the other countries in the green, and the green are actually the forced riders, because these are the countries which have the lowest emissions and the highest vulnerability. So basically, the world is very, very divided. The people who are emitting, essentially the red countries in this figure, and this is changes. The above figure is for 2010, the below figure is for 2030. So you can see that over time there is a change. For example, if you look at China on the top, it moves from brown to red. So essentially, countries that are emitting a lot are not the countries that are the most vulnerable. And the countries that are the most vulnerable are the countries that are definitely not emitting a lot. So this is a known fact, but this is very, very useful when thinking about climate justice in today's times. Okay. Cannot change the slides. Let's see. Okay. So this research is recent research in this direction over the past, you can say, about 6 or 7 years. And we have started to look at these kind of issues also in Norway. So I'm presenting a broad range of studies that go from Norway to the Arctic, where I have been involved a lot, Then going on to Europe, I've been involved in various European projects, and then ending up, looking more across the world. So looking at India, and I've also given an example from Ethiopia. So I'm involved in research in various places. The issues are different, of course, in different countries. But in the end, as I put out in the first slide, the issues are more or less the same. How do you model? How do you look at the cross benefits of interventions? And how do you effectively communicate these things? So in the end, we find that this is more or less the same across the world, even though the issues can be the actual articles are quite different. So this one talks about effect of temperature and air pollution on a population-based cohort in Norway. And you can see here that we found adverse cold effects on mortality. So this is interesting because Norway is essentially a cold country, but there haven't been any studies that have investigated the effect of temperature on mortality and morbidity. And this is actually an area of research that's important because unless you establish this evidence, you cannot model climate change because the future climate change cannot be modeled until you know what is the effect now. So this is a kind of imperative need for modeling. And there have been various kinds of modeling studies, and this is one of them that we put out now. And this looked at a cohort in Norway. So we came out with, individual factors that were important and for this kind of temperature-related effects. And we saw that cold effects are important and have a strong impact on mortality. And there is some interaction with air pollution as well. We have another paper that came out that talked about municipality impacts of temperature in Norway that just came out. And you can see here, this looked across all the municipalities in Norway and also divided up based on the urban-rural fold, the education levels, and then also looked interestingly at hospital times and also found interesting results that it matters a lot where you live and how far you are from the hospital, for example, has strong implications for your impacts from temperature in there. So this is very important for communities and for municipalities to be aware of these kind of risks. We also are currently involved. I don't have results as yet, but this is an interesting issue for those of you who are from Oslo. Oslo has a clear divide across the Akerselva from between eastern and western Oslo. And there has been a new paper that has come out that has talked about how there is environmental health inequalities in Oslo, and that there is inequality in terms of the green areas in particular, which are divided between eastern and western Oslo. And whether this division of green areas and this kind of inequality also means more pollution and more temperature. And we want to go further and see whether these kind of inequalities also could mean inequalities in health, because this is also very important in urban settings to understand how do environmental exposures affect health. So there's also a whole issue, there is more immigrants on the eastern side. So there are other kinds of, health issues that these immigrants face, and how environment affects them is very interesting, I think. We also did some, I will go a bit faster because I will run out of time otherwise. We also did some work on temperature, sick leave, and productivity in Norway. And again, this is a paper in progress. But essentially, we find that people who are working outside, who are involved in physical labor or manual labor, have higher risks from temperature-related sick leave. So they are more likely to take sick leave when temperature conditions are extreme. It's also interesting because this has implications for productivity in Norway. I will skip the slide. We also did have an ongoing paper which looks at Oslo again and looks at the interaction between temperature and air pollution, and essentially finds that these kind of causes correlate very heavily and can lead to more hospital visits, emergency room visits, and increased costs as well. And then going further, we have a paper that is now under review that looks so going beyond Europe and going beyond Norway, looking at extreme weather events in India, how it affects childhood development. And again, here we see that these districts that are essentially poor near the coast suffer huge shocks from extreme events, although there might be some kind of mediating schemes through improved social protection. But this is important. Those who are poor suffer more from climate change. It's obvious, but it needs to be modeled, in my opinion. Until you model it, you cannot prove it in some sense. We also did a paper where we looked at future heat-related and cold-related mortality. Again, no time to go into details, but we found that the effect is quite varied across the different countries, across the different warming levels. But essentially, we found that countries in Southern Europe obviously have a larger impact, while countries in Northern Europe have a lower impact. But as the temperature, as the warming levels go up in the future, you can see that even in countries like Norway, you can see that there is a significant impact. The brown indicates the heat impact, the blue indicates the cold impact, and you can see that increasing as the warming goes up. Now we come to the mitigation. Now, what are the arguments that have been done? Climate change adaptation is already in place. Yes, it is already in place, and Norway is one of the few countries that leads the world in policies. But climate change adaptation in Norway is still at its beginning. It doesn't actually include public health. We have done a set of interviews with various policymakers in Norway, and the conclusion is that there needs to be a stronger link between climate change adaptation and public health, and that policymakers do not still understand how they are supposed to link them together. The other argument is that there are co-benefits from climate change. This is something I worked on. My PhD was on this topic, and this is a complicated issue. Yes, there are co-benefits, but are they straightforward? So, for example, as you have stringent air pollution policies in place, you get lower sulfur dioxide emissions, as you can see in the figure, but lower sulfur dioxide emissions are actually good for the climate. So what does this mean? Is there sorry, is bad for the climate because sulfur dioxide is a cooling agent. So if you reduce sulfur dioxide, that's not good for the climate. So should you keep the sulfur dioxide in and end up, harming the health of the people, or should you reduce the sulfur dioxide and, improve the health, but not necessarily benefit the climate? So this argument has been around for a while, and it's not straightforward how you tackle these issues together. Again, there's an argument that we cannot phase out fossil fuels, very strong, also from Norway, which is an oil producer. But actually, phasing out fossil fuels is not that expensive. So we did a recent study that we are putting out now, and you can see in the blue that the fossil fuel expenditure that you need to phase out fossil fuels. And on the right side, you can see the net economic value of the benefits that you get. And you can see here that the fossil fuel expenditures are not as phasing out fossil fuels is way cheaper than all the economic benefits that you would get if you did that. So this is also interesting that people think it's not possible, but it is possible, but you have to prove it through the numbers again. We already have warning systems in place, and yes, we have warning systems in place. And in this study, we looked at whether these warning systems actually produce any kind of benefits. It's again an interesting read. If you're interested, I can send you the publications. But basically, we find that there are many gaps in current warning systems, and they do not really reach the vulnerable populations, which is important. And we find that this is very much missing in current warning systems that are in place. And then there are things that we cannot improve living standards without affecting climate. Yes, this is something that has been also, this is kind of true. The richer you are, the more likely you are to pollute. And we know this from our life in Norway. But we did this study in India, or we are doing this study in India, where we looked at whether improving living standards, these are various parameters of how you can improve living standards. And then we are investigating whether improving living standards actually affects climate change. And again, it's not straightforward, but our current results show that increasing the decent living standards actually improves climate resilience. It may have some impact, so you get some pollution, but the pollution is not that high. So it's not necessarily a high polluting factor as well, improving living standards in there. Also, we can perhaps go further. And maybe coming to the last part, to the future directions. In the future directions, I'd like to show that there's, going back here, there are lots of solutions. The solutions involve better integration of health in climate change adaptation plans, building climate resilient communities, and integrating surveillance and health systems. This is essential if you want to take all the socio-economically disadvantaged groups into account, take all their exposures into account, and understand how we can build better adaptation strategies. Just some pieces for future directions. One is we have a special issue on climate change and health in the Nordic countries. I urge you again to try and read it. There have been various articles that have been submitted here, and this is coming out now in March. And these look both at exposures to climate change and how they, various patterns of how these exposures differ, but they also look then at climate change adaptation measures and look at how climate change adaptation measures can have different kinds of co-benefits and different kinds of linkages in systems. We also have a new EU project that's out, so I should also give some, say something about that. We have a new EU project that is looking specifically at adaptation policies and looking at how we can integrate technological measures, nature-based solutions, and social measures, which is essentially what I have been talking about. You need to integrate the social measures in order to get integrated adaptive measures. We also have the Lancet Commission on Climate Change, Migration and Health, and I will just mention that because that's another attempt to try to integrate the social aspects of health into the wide-going discussion on climate change and health. So into how you can integrate migration, look at migrant populations as well when talking about this kind of issues. So this is also important when talking about the vulnerable populations and how you can include them in climate policies. I will end with there's some pictures that I actually took. I'm originally from India, so I took some pictures in India. So I will end with that. And India is one of the classic countries where this problem is very, very manifest. It obviously has different exposures to health because of poorer populations. And you see the bricklaying site on the right side, and then which is essentially actually outlawed in India, but you still have these kind of bricklaying kilns that operate. Then you have the indoor cooking, which is a standard problem in most low and middle income countries. And then you can see that India on the bottom right, you can see a solar panel parking, solar car parking panel. This is where I was. We had a solar car parking panel. So it's really made huge progress in renewable energy. And you can see here, India also refused to sign the COP28 Health and Climate Declaration because India refused to do anything about the cold storage and vaccines, because vaccines, the commitment said that you need to essentially decrease greenhouse gas emissions in the delivery of vaccines. And India is one of the world's biggest producer of vaccines, and it refused to do that because this would not be beneficial for it in the short term. So there are lots of issues when you talk about equity and how to interpret that in a country context. And I will end with these figures. There have been lots of good communication. I didn't get much time to go into that, but there have been very good communications. You see the Swiss women who celebrated the climate case win, and they challenged the court in The Hague, saying that they were women and elderly, and they were more affected by climate change. And therefore, there is a need for Switzerland to do something on climate change. And they actually won the case, forcing the Swiss government to do something on climate change. And then you have the Sami populations here in Norway, which have been protesting outside the parliament here, claiming that the land, essentially about land rights and how the land that the windmills were built on are essentially Sami land. So it's also interesting debates on indigenous populations and how they interpret climate change issues. Yes, and the solutions, I don't know. I started out as a global researcher, and now I've done a lot of local research, and it's very confusing in all these meetings. I've been working in this field for more than 20 years, and I don't know anymore. Is it global? Is it local? Is it local? My current thinking is maybe local. Interpreting global solutions in a local way is important to try to see the bigger pictures. Yes, and I'd like to acknowledge, of course, all the projects which I've been a part of, and some of them are not here because they don't have logos as yet, but yes, thank you very much.
Well, thank you very much indeed, Shilpa, for a very interesting and quick presentation. I see there's already questions and a lot of clapping. It was really very interesting, and I hope we can share these slides so that people can see all the reference that you had. Let me see if you stop sharing and people want to put the video camera so that we can see ourselves. I think Marit Voltersvik had already one question, and if not, if you want to, you can also write your messages here where I'm reading. So, Marit, please.
I was too fast, so I was just saying clapping. Sorry. Yes.
Okay, that's fine. So, just if you have any question or comments, yes, Maria, please introduce yourself when you talk. So.
Yes. Hi, my name is Maria Almen. I work at the HVL, Western Norway University not of climate change, but yeah. Anyway, thank you very much for a very, very interesting talk. And I've tried to written down all the references here, so I'm happy to get them. A question about this, about living standards and polluting, because I assume there must be some kind of strategies within the how we live to manage to pollute less. For example, we keeping our high living standard here, but reduce the pollution, and other places increasing. Is there some kind of key points in policies you can point to ensure that also a high living standards society can pollute less?
Yeah, it's a very complicated question. I, of course, live in Norway, and I've lived in Europe for, I don't know, 20 years, I think, and before that in India. And the question is very complicated because I think Norway faces the challenge that it already has high living standards. So the concentration is how we can reduce that. Do we eat less meat? Do we drive less cars? This is the current debate, and this is a valid debate that happens in Norway. India doesn't have that. So that's the other example I put from India. And I think I have Amrita also on board, whose paper I actually put on board. But it's an interesting issue in India because everybody is not ensured decent living standards at all. Mm-hmm. So if you're building up these living standards, there is actually no policy that tells you, if everybody wants to own a car, well, they have a right to own a car. You cannot say you should be biking to work. There are no bike paths. I mean, this is not an essential argument you can give, in Indian cities, which are huge. If they don't want to take the bus and they want to bike to work, it's kind of a valid thing. They have a right to that. But at the same time, I think it's not policies, but it's technological change that drives. So we see essentially right now that the pollution emissions are not so high, even though you ensure decent living standards to all the districts in India. We find that the pollution emissions are not necessarily that high. And this may be because of technological solutions, right? The world has moved on and India has adopted, India has electric cars, India has a huge number of technologies that it has, so India has skipped this part of the transition and it's already in a new stage of transition where it already has a lot of technologies. So it could be that automatically ensuring decent living standards doesn't mean that you end up with high pollution or high GHG emissions. It's something still to be, validated, and we are trying to validate it, but it's an interesting story. And of course, for Norway, it's more complicated. I haven't done those kind of studies, but essentially, driving less in Norway would essentially bring down, both pollution and greenhouse gases for sure. But it's complicated. It's a long country. You need to drive. Some people need to drive. So it's not straightforward. But yeah, that's my short answer.
Thank you. Thank you.
Thank you very much.
Hi.
Anne?
Yes, hello, and hello, Shilpa. It's always a pleasure to hear your presentations. Thank you so much. Very, very valuable. I was thinking about the cold and hot temperatures. And I was wondering, for instance, in the Norwegian study that you presented results from, because I was thinking that depending on where you live in the world, what is hot and what is cold kind of varies quite a lot. I mean, hot weather in Norway is completely different from hot weather elsewhere. And do you know anything about, is there an international consensus helping us to compare hot and cold health effects across the globe, or is it do we have to take every country separately?
Yeah, there has been. So we have one study that I think that I didn't put up, which was, but this study actually uses this kind of terminology of looking at moderate cold, extreme cold, moderate heat, and extreme heat. And this is based on the percentile distribution or depending on the temperature conditions, and where your cutoff points are. And of course, this is quite different for every country, right? Where this kind of percentile, but there is this kind of definition on what you define as extreme cold or moderate cold, and in Norway, actually, it is not the extreme heat or the extreme cold that matters, because if it's extremely hot, unlikely, not happened in Norway, extreme cold means you stay at home, right? So we had this minus 20 degrees in Oslo last winter, and the government essentially said, stay at home, don't go out. So when you actually do go out, it's what we call moderate cold, which is, above minus 20 degrees, but it's still enough to cause you health effects. So it's a question. So that's how you define it. There's no universal definition of, let's say, heat waves. This is also complicated, but there is some definition of moderate cold, extreme cold based on the percentile distribution. And this is what most researchers use, because when you want to do these studies, you need to understand what is moderate cold in your country, essentially.
Exactly. Yeah, thank you. Yes.
Thank you very much. I have a question myself. You said something that that it's kind of funny and sad and very real. You were talking about the social inequalities making a difference. You say it's obvious, but it needs to be modeled. And I think this is not only for climate change. It was the same for the pandemic. It's for many other complex situations that we have. But do you see this happening in research in the world? You say that this is going to happen. What are the drivers of this interest that you were talking about, introducing social inequality in this combination of climate and health? Is it because, what can we do to put it forward so that it's seen?
Yeah, I don't think we need to do so much. This is essentially, you can say, researcher boredom. So after you have modeled this for a while, you start asking yourself the obvious questions. Who is suffering as a result of this? And how do we model this kind of population better in our studies? So I think from a research perspective, you don't need to do so much, because researchers are genuinely interested in these questions on who is the most affected. Also from the adaptation policies, there has been a lot of interest in modeling them. And as I said, we need more evidence. So there's, all this thing, and we cannot phase out fossil fuels. We cannot, essentially, the health benefits and the climate benefits are different. There are various arguments, but there have been a lot of studies recently which have shown that these arguments are not necessarily valid, and that you can, tackle these challenges. I think the issue lies with communication. We are unable to communicate this with policymakers. I worked in the field of co-benefits. Let's say I got my PhD early 2000s, and until now, everybody talks about co-benefits, but no policymaker ever mentions the word. So they have tried and tried and tried to tell, policymakers that, there are co-benefits associated with climate actions. If you reduce greenhouse gas emissions, you also get health benefits from these kind of actions. No policymaker has picked up that kind of argument ever. So I think there is a flaw in the way we communicate these to the policymakers. And I think that's where the next, line of research needs to go. And how do you communicate this? How do you come up with something that policymakers might actually take into account? But of course, the world has changed. It's a different kind of world today, and these kind of arguments are no longer that straightforward. I think everywhere in the world, getting more difficult to communicate these things.
Thank you. I wonder if there's, if I cannot see everybody at the same time. So anybody, if you have a question or a comment, just let me know. But following a little bit your answer until then, how do you work yourself with this dissemination to the policymakers? Of course, one thing that we always talk about is this of co-production and including policymakers from the very beginning. But as you say, this is very much linked to many other values. What is important, and so what is your recommendation to work further in communication with this issue? Because climate, at least in Bergen, there has been quite a lot of researchers who do not want to go often in the public, to the public media, because of having, I mean, it's unfortunately not always a very nice response for the public. So do you have any good advices for people working in this field and how to communicate with public and policymakers?
Yeah, I don't think the policymakers are uninterested, right? Especially in Norway. I mean, there is, and I think in Norway, the difference to other countries is that there is a strong mandate for climate adaptation already in place, mitigation, adaptation. These are words that most young children already in Norway know what they are. There's a strong mandate to do this in Norway, I think. But I think where the problem lies is money. where do you invest your money? And this is quite, you can see it. And this is where I think we have a problem in other parts of the world. There is no such strong mandate, first of all, in place. And so as the governments change, you are at the mercy of the government because there is no mandate that overrides the government. So that's one issue in most of the world. You have to follow the dictates of the current government. There are a few countries, I think, which have done this really well. I listened to a good talk from Mozambique right now, and Mozambique has extremely good policies in place which are not dependent on the current voted government. And this is a huge thing because then you make decisions that are independent of the person who's in place. And I think this is what is needed, but this is of course not in our hands. But I think this is what we need to aim for, establish these kind of systems in place. I think in terms of communication, I think we need to communicate things that work and things that work well and things that do not work. These need to be very clearly communicated to the policymakers. And it may seem that you're kind of hammering, on something, but that doesn't necessarily produce good results, but I still think this is essential. We need to have that line of communication open. And I'm a researcher. I hate communicating outside. I'm one of you. I don't like talking to the media, but I think unless you do that and unless you figure out a way to do that and unless you employ people who are good at doing that, we have a problem because none of our results are actually in any way applicable to policy unless you have somebody who can translate them into messages that the policymakers can interpret.
Thank you. Marit, is the question you have now or a comment? You are muted.
Tell about the public health law gives us a lot of obligations in the community, and we have the public health plan. Every community or municipality need to make your public health plan, and we did that in Bergen now, and we take into account all the knowledge that's around. Like you are producing now, take it into account in the plan. So air pollution is actually quite integrated in the public health plan in Bergen, and they are for the public too. The public can read the plans, and the strange thing that you seldom find that they are arguing against it. I don't think they read them, so that's why we don't get any fuss around the plans. But I think what my opinion is that we are really concerned about this in the local community, the knowledge we have, and there is knowledge we don't have that we need you to produce for us, so we can use that knowledge and that the researches you do. So as long as you can do good researches, we can put it into, and I think the public health law is a very good thing in Norway to use for the next time we should make a new public health plan. Yes.
Thank you.
Thank you very much. We are about to end. If there are no more questions, I would like to thank you again, Shilpa. There was a lot of information in what you said, and you have done an enormous contribution to this field through a lot of research. Very thankful for you being here with us. The meeting has been recorded in case anybody needs to have a look at it again, because it was very, very quick, but the slides will be there to see the references as well. And when you told us that there is a new Scandinavian Journal of Health is coming with something especially about the climate. So we will, when it comes, just let us know so that we can post it directly into our website so that people can have a look at that, if that's
yes,
okay.
Thank you. It should be out. I think right now the plan is that it comes out in March. So we have the final article that is being proofread at the moment. So that needs to be approved. But right now, fingers crossed, if everything goes according to plan, it should be out in March. But I will send you the link. I mean, the articles are already online, right? The articles are online, but the whole special issue has not been released as a whole. The articles are online, but we will put out the release of the special issue in March. I will let you know so you can download all the articles, or if you need any of the articles, please get in touch with me. I can send them to you.